I'm Brandi Kruse, and this is Undivided. Undivided is brought to you by 1530 Mortgage. Visit them at 1530mortgage.com. Today, an in-depth conversation with Washington State Health Secretary Dr. Umair Shah.
How do we work towards getting our communities ready to be dealing with COVID for the longer run? And not just COVID as an emergency, but really think about COVID that's going to be within our lives or in our lives for a long time coming.
His thoughts on the pandemic being politicized and the leadership of his boss, Governor Inslee. Do you believe that the governor's messaging has been helpful?
I think his messaging has been helpful in many respects. There are times where the messaging has been hard for some to hear.
I'm Brandi Kruse. This is Undivided. Thanks for being here. We're going to do something a little different on the show today. I got a chance to speak at length with the Secretary of the Washington State Department of Health, Dr. Umair Shah. We talked about really everything about where we're at this stage in the pandemic, where the pandemic is heading, where we might be in a couple months. And we also talked about the politics of the pandemic. We talked about some of the things his boss, Governor Inslee, has been criticized for. We also talked about mandates, vaccines, hospital staffing, really a wide-ranging conversation that, for me, centered around an effort to try to lower the temperature around the COVID conversation and try to get us moving in the same direction as much as possible as we try to get out of the pandemic after more than 2 years. This is my conversation, unedited, with Washington State Health Secretary Dr. Umair Shah. Give me your credentials. Why are you qualified to be in the job that you're in?
Well, first of all, Brandi, thanks for having me. I think the first and foremost thing is that I'm a physician. I'm a healthcare provider. I'm a doc. I spent 20 years as an ER doc, taking care of our nation's veterans in Houston, full-time and part-time. Along that way, I also found my way into public health, which I really equated to being where the community becomes our patient. And we really zoom up to levels where we're looking at what's happening for the health and well-being of the entire population. And I've been doing that for just going 15, 20 years now. So it's just a combination of being a healthcare provider, a physician, but also being in public health. And I think that, plus the fact that I've been through so many emergencies, from natural disasters, whether hurricanes, but also infectious disease disasters or emergencies or potential crises, from H1N1 to Ebola, Zika. And then I've also responded on a global setting. So I think maybe all three of those together hopefully make me qualified to be in this position.
And I will just get this out of the way, because you told me before we started that you're a Bengals fan, which I guess will still, accept you. And you have your shirt on. You can show your shirt off if you want. I'll give you one softball, and this is it.
Well, I will show it. There it is. And you saw I took the glasses off the moment you talked about my football team. It's been a 40-year journey, and 30 of those years have been not really very happy. So I'm really excited right now.
Well, congratulations. We're happy for you. Dr. Shah, how would you characterize where we're at right now in the pandemic?
Well, I think we're at an interesting phase. One is that all of us are tired of this virus, this pandemic. We want it to go away. The reality is that it has not gone away. And we have now been 2 years, I guess it was about a week or two ago, where we had the first case in the state of Washington, which, by the way, was the first case in the United States. And so you fast forward 2 years of just these ups and downs, phases, and all sorts of things when we didn't know a lot about the virus and how to protect ourselves against it. We learned more information, evolutionary information, evolving information. And, now we're at this place where, unfortunately, we're seeing additional variants, right? The Delta variant in the fall. And then certainly as we started to see cases and hospitalizations come down, we then we're in the midst of Omicron. And so Omicron has really been hard because it is so transmissible, meaning so infectious, and so person to person to person. But fortunately, we haven't seen proportionally as many people being hospitalized as we saw with Delta, yet our healthcare systems are stretched and strained and stressed. And so I think where I would say where we are is we are just like every other community, every other state, even other countries where we are doing the best we can with just all the different tools that we have, but also recognizing that people are really tired of this pandemic.
There are folks in national media, national experts who have talked about Omicron as being our pathway to an endemic. Do you agree with that? And can you just define endemic and kind of what that looks like?
Sure. When people refer to endemic, what they're really referring to is that we're going to see a change, a pivot, where we will have COVID-19 or we'll have COVID in our communities, but we're going to be more living with it. That is an ongoing phase. That you have people who are going to get sick. You're going to have people who are going to unfortunately get hospitalized, but we're living with it. We know what the tools are. We're empowering ourselves with good information. But really, the reason they're referring to Omicron in that way is that Omicron is so transmissible. And so as you've seen, even with our case numbers, they have been sky high compared to what they were previously. And it's because you're going to have a lot more people exposed, a lot more people that are going to get infected. And what we're trying to do is to make sure that we don't have people who have severe illness. So I think that's what endemic means is that this is going to go on, but we are going to know what we need to do in order to be able to fight it.
Can you anticipate when we'll reach endemic stage? Is it months? Is it 6 months, a year?
Brandi, it's one of those where it's hard, like even when we were talking about the football stuff, it's hard to know when you're in the middle of a winning season until you're actually winning and you're in the middle of the season, right? So some of it is that we anticipate what's going to be happening, but some of it is really going to be a recognition once you're actually in it. And so what I would say is that we are at a place where we know a lot of people are getting infected. Thankfully, a good portion of those people that are getting infected are having either mild illness or, something that's not causing them to go into the hospital. But the hospital systems are still stressed. Why? You ask, well, why are they stressed? Well, they're stressed because they have people that are coming in with COVID. They have people who are in the hospital for another reason and they're being diagnosed with COVID, or they're in the hospital for other reasons, a heart attack or a car accident. And so all that adds to what is going on in the healthcare setting. So are we there today? No. But I do think where we are is how do we work towards getting our communities ready to be dealing with COVID for the longer run, and not just COVID as an emergency, but really think about COVID that's going to be within our lives or in our lives for a long time coming.
I want to pepper in a question because it fits with something you just said from an undivided viewer. Don, he said at the beginning of the pandemic, we had field hospitals set up that ended up being unused, which is true. Now that hospitals are at capacity, why are we not setting up field hospitals now? What would you say to Don?
Yeah, Don, that's a great question. And, I'll be honest, Brandi, I was the first year fighting the pandemic on the front lines in Texas and Houston. And so we also had a field hospital that was set up there. And we saw it as success because we had not a singular patient that was admitted to that hospital, and very similar to what was happening here in Washington. And I think what we have found, one, is that those were in essence insurance policies ready to be enacted in case you needed them. But today it's really not as much about space. It's really about people. It's about staff. It's about shortages of staff. And so even if you set up a 500 bed field hospital, that's not going to really solve the issue, which is you just don't have enough people in the medical profession to be able to handle the patients that are coming in. Why? One, because you have many that just burned out and they left. But the other is some of them are sick. Some of them are infected themselves now with COVID-19. And so they have had to take time off to take care of themselves or their family. So I think there are a couple of things going on here, but that field hospital concept is one that's in our back pocket, but not one that would really fit in the phase that we're in at this point.
Well, couldn't you bring National Guard in and set them up at the field hospital and have them deal with things that aren't quite as serious, that don't need to be in an emergency room setting?
Well, what we've done instead is we've taken National Guard, and as you know, the governor had announced this a couple of weeks ago. We've actually deployed them in the facility. So when there is space there and they're having a staff shortage, rather than setting up what we call an alternative care facility, an ACF or an ACS, alternative care site, you actually go ahead and put those personnel in the healthcare setting itself. And that's what we've been doing over a number of hospitals across the system. And it's not just the National Guard, but we're also utilizing a federal contract to have well over 1,000 personnel that are now in the healthcare setting as well. So we're doing everything we can, but we're trying to keep it within the healthcare setting. The one area that we have also been leveraging is where we have difficult to discharge individuals, people who, because of other social needs or care needs, they're finished with their acute care stay in the hospital, but they need to get out somewhere. We're working so that we can get them to perhaps a long-term care facility or a location where they can be taken care of before they transition home. So there are a lot of things we're doing already, but the field hospital concept is just one of those where it just doesn't feel like this is the time for it.
We're going to talk more about hospital staffing in a moment, but I want to talk about politics. First, do you consider yourself a politician?
Me? No,
Yeah, no.
no, I do
I,
not.
I think that's fair. I think some people would say public leaders, politicians, but I agree with that characterization. You mentioned that you came from Texas. Harris County, you led the health department there. Harris County is a blue county. Houston is the county seat, right?
Well, so things have changed. Houston's a very blue city. The county itself, from a political standpoint, is actually very red. When I was first appointed Harris County public health director of the health authority, it was a 4-1 Republican elected leadership. It was, by the way, unanimous. It was a 5-0 vote. So it was really a red county with a blue internal core, if you will. And if I could just for just a second editorialize here, that's been one of the biggest challenges during this pandemic, is just how politicized everything has been. And so when you ask me the question, why do I not consider myself a politician? Because I always consider myself a health professional, whether it's a healthcare professional or a public health professional. I always consider myself above the fray of the politics. And it's gotten ugly in this country: red, blue, left, right, east, west, all that stuff. I care, but I don't care, if that makes sense.
Yeah.
I'm really about when I was taking care of, patients in the ER as a VA doc for all these years, I never had one of my patients come to me and say, doc, I know that my blood pressure is high. It's, 200 over 130. I know you're about to give me the IV, metoprolol or, Lopressor or what have you. Oh, guess what? I'm not going to take it because I read something on the internet and I don't believe you that blood pressure medicine works. That's the politicizing that all of us in public health and healthcare are dealing with right now, where we're not able to put the health piece, the medical piece first. We're stuck in this vortex where it's everything else, all the other noise that's in the mix. So that's why I don't consider myself a politician.
Have you seen a difference, though? I mean, Harris County, it went for Biden in 2020. That's why I call it a blue county. But in a deep red state, and now you come here and you came here about a year into the pandemic, just shy of a year into the pandemic. Have you seen a difference, politically speaking, into how, red state to blue state, into how your orders are received or your press conferences are received? Is there any difference there, politically speaking?
Sure. I mean, there'd be no doubt. I mean, first of all, just coming from Texas to Washington, in and of itself. By the way, my kids remind me this every single day. We have a 12-year-old, a 7-year-old, and a 5-year-old. Every single day, they remind me about how Texas is different and Houston is different and why do we come here and all those questions. But at the same time, what we also recognize is that whenever you go from one state to another, you're going to have a change, especially when you're not going from a Texas to, let's say, Louisiana or in Arkansas. You're going Texas all the way across to the Pacific Northwest. And then in the midst of all that, you're doing it during a pandemic, which is already becoming politicized. And then there's a different way of looking at the world. So absolutely, when, I know that certain things that I was saying in Texas, at times it was different than what the state was saying, because the state government, as you know, in Texas tends to be more conservative than it is here, and so is more red. And so absolutely, there were things that we were saying that was a contradistinction to what the state was saying. And then you flip it around. Now we're at the state here in Washington, and there are things that I'm saying or we're saying, and now it seems in certain communities across Washington, it's not as well received. And so I think that's, again, the politicizing that's gone in. I wish people would see it from the health side of it rather than from the political side. And that's just not happened.
Well, let me ask you this. Who do you blame for the politicization?
Well, let me zoom up to what I always say when somebody asks me this question. Do you remember Independence Day with Will Smith, that movie?
I do.
Yeah, there was I watched it again with my kids, and I made the mistake. I forgot Houston got annihilated in that, and that was really not a good scene, because my 5-year-old was like, wait a minute, what happened to, wait, our family friends are still. I was like, oh, okay, I need to pause for a second and explain that Houston is still fine. In that film, if you remember, the common enemy was the aliens, right? The aliens were the common enemy, and everybody in the entire world got together to fight the aliens. In fact, if you remember, the president even got into a fighter jet and went up and tried to take on the aliens. We weren't fighting each other. So I think what I would say when I put, when I go back to the context of where we are today, we have missed this real opportunity to work with each other and communicate with each other and not fight each other. So our common enemy should not be other Americans, should not be other Washingtonians. It should be the virus. And that's the part
I don't disagree with
hard.
you, but how did we get here? I think in order to diagnose a problem, you have to understand what happened. Is it the press? Is it politicians? Is it social media? How do you think we got to the point where we were attacking each other as opposed to focusing our energy on the virus?
Well, first of all, it goes beyond COVID-19, because this was happening even prior to this pandemic starting. But number two is, I would say yes, 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 yes. I mean, it's all of the above. All of this has contributed to where we are, and there has become a mistrust in science, in evidence, in government. There's been a mistrust in, your question, are you a politician? Even that question, comes into, this real mistrust in what does a politician mean? Is that has become a negative word rather than being a word that, about a policymaker, somebody who is going to, help with trying to enact policies to help people. So I think there's just a lot that's gone into this, but this is well beyond this pandemic. The problem is the pandemic happened in the context of a deep amount of division and real strife in our country. Everything about how do we do race relations? How do we look at, where do we spend our dollars? How do we, approach our global communities? All of that happened. And now in the midst of it, you had a pandemic. And so I just think it accelerated things.
Yeah, and I do agree with you that there's probably a trifecta of blame: the press for sure, politicians for sure, social media and the nature of it for sure. I know that you served Dr. Shah at the pleasure of Governor Inslee. I'm hoping still, though, that you can be honest about this next question. He's been criticized for his messaging. He was over in Spokane and talked about Trump supporters, unvaccinated Trump supporters killing children. He likened unvaccinated people to terrorists. He had a TVW gaffe where he said there's only one person in the state who can save lives, and it's the governor. Do you believe that the governor's messaging has been helpful?
What I would say, Brandi, is that I think his messaging has been helpful in many respects. There are times where the messaging has been hard for some to hear. Now, there is a reality that there is misinformation out there, and that misinformation has to be called out. We cannot just let it go. So I understand where he's coming from. And I'll tell you, in this year, I've talked to him, learned from him, heard so many, comments that he's had, or listen to him, in the quieter moments where he's not in the, in the stages, and I'm listening to him. His heart is in the right place. He is an incredibly learned man. He reads, he's constantly trying to get things from other parts of the world and things that he's hearing, reading. He wants to know, is this true? And he's asking me as the health secretary, what is your take on this? What's your recommendation on this? So I know his heart is in the right place, and I know he truly believes where he needs to go with asking the right information. Where the politics comes in, that's where I think this is not just about him. This is about where we are as a society. And I think that's where my biggest challenge is. And I enact this, I relate this to, the far extremes. Well, in a former life, I played some tennis, and if you think about the far courts, whether it's the left or the right, when you're playing tennis, not many people are playing at the net. They're always playing a little bit back. What's happening in this country is that the narrative, whether it's from the left, the extreme left, or the right, the extreme right, is what's dominating the vast majority of people who are in the near courts, who are by the net, who are trying to go get their kids to school on time, who are trying to go to work. They're worried about their jobs. They're worried about, how they're going to put food on the table. They're worried about, what's happening to their neighbor across the street, regardless of their political persuasion. They are worried and concerned about everyday life. But guess what? It's the left and right, the extremes, that are dominating the conversation. And so we now as a country look divided. But what it is that there is a silent majority that's in the middle. And by the way, if you're in the middle, you're not even able to have airwave. You're not going to suck up any time on those airwaves,
unless you are on Undivided, because that's what the show's for.
Undivided is the reason I'm here, Brady, because I knew that was the and that's where the biggest concern is. So that's the way I would answer that question. Is my concern is that we as a society have just come to this place where we have to call out what's wrong, and people have different perspectives on what's wrong. But I will also say that we have to get to a point where we've got to figure out a way to heal and come back together.
Yeah, at the same time, words matter, and especially from a governor. And when you've got a governor, saying he's the only one who can save, we both agree he's not the only one who can save lives, right?
Well, we can all save lives, but I do think the governor has an incredibly important position, just as a president does, just as a CEO of a company does. I mean, there is an incredible role that the top of that pecking order has. But yeah, you're right. I mean, everybody has an incredible role, an important role that really comes into it. It just happens to be that the elected official at the top has probably a significantly different role than someone like me.
A lot I want to fit in. Have you been following the Joe Rogan Spotify controversy?
I have.
Joe Rogan said something. He came out, released a 10-minute video, and he talked about that word you used, misinformation. And he said that he feels like that word has lost a little meaning during the pandemic. A couple examples he gave. There are times in the pandemic early on where people would say things that would be dismissed as misinformation, and now they're widely considered to be, a possibility or to be true. Like, could COVID have originated in a lab? Do cloth masks actually work? Can vaccinated people spread COVID? And, those people were dismissed as conspiracists. And then, fast forward a year and, well, gosh, they were kind of right. Do you believe that health officials have been transparent and honest enough, contrite enough to come forward and admit when previously believed things turned out not to be true?
I hope so. Brandi, I always come at it from the perspective that medicine evolves and it changes. What I remember in residency 20 years ago, if I go to my patient and say, look, I would love to give you the newest blood pressure medicine. I know it's going to work, or the new diabetes medicine, but 20 years ago, that wasn't around. And so I'm not going to use it. My patient would laugh me out of the building and say, what do you mean? I want you to give me the latest. I want you to give me the evolving information. I want you to tell me what's important now. Don't tell me what you learned 20 years ago. That is the nature of how medicine and science works. whether health officials can and should do better, I actually think they can. And let me give you this example. Brandi, I think when I look back to my training, medical school, residency, fellowship, right? 4 years of medical school. It was 3 years of residency. It was 2 years of fellowship. That was on top of undergrad. That was on top of high school, right? We're talking about an extremely a large amount of my life was spent learning about medicine and how to take care of patients. Not one time during that training did I learn how to communicate. And not one time was I given a formal class on communications or even having a respectful dialogue with people. And so where I'm going with this is that where medicine, health, and science, in my mind, has failed, okay? So I'm very honest, I'm authentic, I'll tell you how it is. Where I believe we have failed is that we have straightened up, put on our white coats and said, believe me because I've got the white coat. But where we have not gotten good at or good enough at is to remind people that we're also connected with the community. We're also human beings, and we also care about the very people who are part of this. Everyone is always thinking of us as a stoic, kind of a box and with the white coat on. And that's where we have failed, that we have not done enough to remind people that we also are parents, sons and daughters, community members, neighbors, fellow coworkers. So when vaccines were coming out for kids, and someone, one of them, the reporters asked me, hey, are you going to get, what do you think about parents who are concerned about vaccines for kids to get their kids vaccinated? And I said, guess what? Let me start with I didn't start with as a doc. I didn't start as a public health. I started as a parent. And I said, what I am concerned about as a parent is this. What my wife and I talk about every single day is the health and well-being of our kids. So that's where we have failed in medicine, is that we have failed to connect with people. And that's why people then have mistrust.
Well, and it's an interesting, I haven't heard anybody, bring that up, that sort of idea of we learned a lot of things in medical school, but not, the kind of public facing part of it. But in fairness, I don't know that a lot of people anticipated what the last 2 years would be like for health professionals. So maybe that's something that medical students, that should be a regular part of their education, is how to message to the public. I mean, that.
Oh my gosh. Yeah, but Brandi, we should. So shame on us. Why not? This isn't the first emergency that we have gone through. I can, over my career, I can tell you, I was there, Tropical Storm Allison. I was there, Hurricane Katrina response with 27,000 evacuees at the Astrodome, Hurricane Harvey, Hurricane Ike. I can tell you about, all sorts of, H1N1, Ebola, Zika, a teenager who died of rabies. And by the way, it also exposed all sorts of people at his church and swim meets, et cetera, et cetera. We should be better at communicating with people. Why? Because this is not the first time that we have had to do this. But if we're not going to get those skill sets to the very people who are then expected to have that conversation, then again, it's a failing of our system.
We now know that people who are vaccinated can get COVID, they can spread COVID. It's why we're seeing such large case numbers, despite the fact we have a vaccination rate of over 70%. So as it pertains to the vaccine mandates, there are some entities that have started to institute regular COVID testing on top of vaccine mandates as a more reliable way to slow the spread. Is it time to reconsider the vaccine mandate, given the fact that vaccinated people can spread the virus just as easily?
Well, I think let's go back with one conclusion that you reached there, which is what was the purpose of vaccines? The purpose of vaccines was not only to eliminate COVID-19, as in you could not get infected. The real purpose was we were trying to prevent people from having serious illness, hospitalizations, being on a ventilator, and dying, right? That progression is really important to remember, because that is where the healthcare strain and the surge comes in. So when you have requirements that are put in place, it's for twofold, right? One is you're trying to protect the individuals and the workforce, but you're also trying to protect the people that they are serving or caring for. So I think it's important for us to remember that. That is something that has gotten lost, where we start to think about the zero-sum game is when cases are going from 15,000 to 20,000 to 30,000, 40, we become numb and desensitized. But the real goal was to prevent people from really having a serious illness. And vaccines have been really good at that.
Yeah, and
really,
I agree. And I have
really good at that.
And I have told every time I talk about vaccines, I make sure to mention I'm fully vaccinated. I think people should get them, ask their doctors if they have questions or concerns about them. And we'll get to vaccine hesitancy to wrap up when we're towards the end here. But, as an example, when we talk about vaccine mandates and where I think people get frustrated and politics comes into play, there have been news stories across the country, including here in Washington state, about hospitals requiring COVID positive nurses to still come to work if they're asymptomatic or experiencing mild symptoms that are improving, including multi-care here in Washington. I mean, it sends a weird message to have fired unvaccinated nurses and then months later have a policy requiring COVID positive nurses to come to work. Can you understand how someone would look at that and be like, how does that make sense?
Yeah, I can. And I also understand as a healthcare provider. So this is where, as a healthcare provider, I also see the other side of it, right? I also see the doctors and nurses and all the people that are doing such an amazing job to care for people. You do not want somebody to get sick because that healthcare worker is bringing it into the workforce. That's where the vaccine requirements come in, that we're trying to do what we can to really prevent people from, at the end of the day, spread it on to someone else. Now, Omicron changed things, right? Because Omicron became a game changer. It wasn't as much about just, hey, we're going to be able to prevent you, not just for serious illness, but even the ability to get infected with COVID-19. Unfortunately, Omicron changed that. Now, of course, that's the part of this that has been really hard, because what we're also trying to do is to show, which is, by the way, the workforce has decreased just a small amount. And when you go, by the way, to the hospital and healthcare colleagues and public health colleagues that I've talked to in Eastern Washington, Central Washington, and Wenatchee and Walla Walla and Spokane, and I've talked to them, and they said, thank you for enacting this, because we couldn't do it ourselves. You gave us the ability to do something that we know is important for our own healthcare hospital system, our workforce. And yet that's the message that oftentimes gets out. And that, Brandi, is another example of the politics. Mm-hmm. It goes into this.
But do you support then the decision of individual hospitals to allow COVID positive nurses to be at work?
Well, I think what we have to look at is what phase we're in, right? If you're at a crisis phase when it comes to personnel or staffing or PP, there is a different way of looking at the world. Now, I know that, especially with one of the hospitals that you mentioned, we're looking into that. So we're making sure we're understanding what's happening. So I'm not sure I'm going to be able to say yes or no. Do I support or not support? What I'm going to say is that we need to look at every one of those situations and make sure we understand, is that happening for the appropriate reason? Are there any other options before we go into this kind of setting? Now, if you can think of a scenario, Brandi, you're a smart person. You could think of a scenario. I know you can. I know you could do a screenplay of a movie right now. If I said, could you write me a screenplay that came up with an instance where a number of different individuals all across the country in all sorts of settings needed to do something to be able to take care of people, and they were COVID positive? Could you write me that screenplay? And you would say, absolutely, I could, right? We can think of a scenario when you stress the system. So the question is, are we there yet? That's the question.
So you're looking into that. I'll follow up with your staff. I want to end with two questions from unDivided subscribers, and then give you a chance to try to convince people who have so far been unconvincible about the vaccine. Timothy asks, and this is a good question, I hear about this a lot. He says, when will a state acknowledge natural immunity?
Well, I think we have. I mean, it's not that we haven't acknowledged it. I mean, you've probably watched my press briefings. We've said that we just don't know enough information about how long it lasts or how broad it is, how reproducible, reliable it is. That's the kind of information we don't know. So natural immunity is not something we haven't acknowledged. It's just that it's not as reliable. So I can tell you with the vaccine that we know that you don't need to get a booster for some period of time. Why? Because we know you have enough immunity. I can't tell Brandi versus Umair versus Jim on the street whether it's 1 month, 2 month, 3 month, or 4 month when it comes to something related to natural immunity. And that's why I think there do need to be more studies or much more information about natural immunity, because this has been an ongoing question across the country and across the scientific community. But unless we get that primary data, what is the answer that I'm going to give, which is we don't know enough and we know vaccines are better. But when we, again, evolution.
But if you don't know enough, how do you know that
Brandi,
vaccines are better?
But 2 months from now, you're going to say, but Dr. Shah, now you have the studies and now you've changed and you've said, hey, guess what? Natural immunity. And now I'm in a pickle because 2 months ago today on your show, I said, well, we don't know enough and this and that. So what we do, look, I can only tell you what I know, right? I can only tell you what the studies show. The studies are showing that vaccines work. They're safe, they're effective, they're reliable. They give you protection, a more reliable protection for a longer period of time. I can't tell you about natural immunity. So now you're going to say, well, Dr. Shah, why aren't you talking more about natural? Because I don't have anything more to talk about. By the way, recently, actually, over the last several press briefings we also talked about empowerment. We talked about the importance of making sure that you took care of your physical health, your nutritional health, your mental, emotional, your spiritual health, that you were taking vitamins, you were sleeping, you were doing all sorts of things. We are absolutely acknowledging that we have to empower people with tools. Again, forget the politics. I'm just telling you as a doctor, if you were my patient and I see the community as my patient, Brandi, I'm trying to empower you with how can you be safer and healthier. And that's what I'm going to say. Look, right now, there's not enough we know. So put a mask on. I don't know enough about, everything else going on in the world. Get vaccinated. I know that your immune system is going to lose that protection. Get a booster. These are things that I do know because of all the information that the summation of what I've seen and read and the scientific literature. But I can't tell you things that's not out there yet. So that's where I would leave it.
All right. Let's just end with to people who have so far not gotten vaccinated. I'm sure you heard the story about Robert LeMay, the former state trooper who passed away due to COVID, who was unvaccinated. What do you say at this stage to people who, a year in to vaccine availability, to people who have been unswayed?
Well, I wish that I could say as much as what you have heard me say before, but I will say it maybe differently because maybe that message isn't going out, is forget about all the noise. Forget about everything else that's out there. Does it make sense to protect yourself against a new virus that we had? And that new virus that we have, and that new virus that we have, the protection that we know that works are you either stay away from getting infected and you do things to protect yourself, or if you get exposed, you are protected, whether it's because of some piece of natural immunity, or if it's really more reliable longer term with vaccination. So I would hate for, whether it's a trooper or whether it's a doctor or a nurse or a janitor, a teacher, a student, a fellow student in my kid's school, whether it's a community member, if they had a tool that was going to protect them from this pandemic, from this virus, and we didn't give them the information on utilizing that. So forget about the noise, forget about the politics, just go and talk to a healthcare provider that you trust and just try to understand whether that vaccine is for you. And I'm sure that if you're going to be talking to a healthcare provider, they're going to tell you what are the things that you're going to need to do to help yourself and protect those around you. And vaccines are an incredibly important part of that.
All right, Dr. Umair Shah, the Secretary of the Washington State Department of Health. I do appreciate you taking so much time, way over, even including the overtime, to chat with us about these issues. So appreciate it.
Brandi, thank you so much, and we'll do it again.
Sounds good. And I certainly appreciate Dr. Shah taking some time to join us. I think he knows that the audience that watches Undivided is politically diverse. I told him I think it ranges from moderate Democrats all the way to Trump Republicans. And there is a lot of difference of opinion in there as to how the pandemic has been handled, how it perhaps should have been handled. And what I appreciated about our conversation is that he was willing to acknowledge that, look, of course, what we've done hasn't been perfect. Health officials could stand to message a little bit better than they have. And I think making some of those acknowledgments is really key to trying to get people on board that you've lost along the way. I mentioned part of that Joe Rogan conversation where Joe Rogan said, look, people called stuff misinformation a year ago that is now widely accepted. And it's really important for politicians, for the press, for health officials to come back and to acknowledge when they got something wrong. For instance, on the lab leak theory, the press called people conspiracists who even brought it up. And then it turned out that, well, the government thought that might be a real possibility as well. And so I think throughout this entire pandemic, people who have a platform, be it politicians, health officials, or the press, could have stood to operate with a little bit more humility. Not speaking in definite standards, saying, hey, this is how you protect yourself, when you don't really know. I think, and I said this at many stages during the pandemic, that I kind of wish elected leaders and health officials had come forward and said, look, this is an unprecedented situation. We are going to try some things along the way. We're going to give the best advice we can based on what we know. And we might be wrong. And we're going to try to admit when we're wrong and change course. And we can all sort of try to get through this together. I think that would have gone a long way to bridging some of the divides that we're now seeing as a result of the pandemic. All right, thank you so much for joining us on Undivided. If you have not become a paid subscriber already, that is how I can continue this work independently. You can do that in two ways, on Patreon, patreon.com/undivided, or by becoming a contributor on my Locals community, brandikruse.locals.com. Undivided is brought to you by 1530 Mortgage. Visit them at 1530mortgage.com.